Welcome to our sonography lecture on adrenal pathology, part 2 of 2, focal adrenal disease for the sonographer. This lecture will cover adrenal adenoma, PHEOCHROMOCYTOMA, adrenal cysts, adrenal carcinoma, and metastases. Let's go ahead and begin then with adrenal adenoma. So adrenal adenomas are the most common benign tumor of the adrenal gland. It can be hyperfunctioning, as we saw with Cushing syndrome and Conn syndrome, where it produces extra hormones, or it can be non-functioning. The clinical signs and symptoms of an adrenal adenoma include those of Cushing syndrome and Conn syndrome, or they can be completely asymptomatic. On ultrasound then, we will see a solid mass, typically on the hypoechoic side and in the area of the adrenal gland. Now remember, the adrenal gland is not well seen by ultrasound when it is normal. If there is a mass in the area that we suspect superior to the right kidney or superior and slightly medial to the left kidney, then we might start to suspect some sort of adrenal pathology. However, it is not definitive when seen by ultrasound. In this example here, we do have an adrenal adenoma. Again, it is kind of in the area that we would expect the adrenal gland to be, most likely proven to be an adrenal gland either by MRI or CT. It has a solid appearance that is hypoechoic. Here is another example of an adrenal adenoma. We have the kidney here. We have a structure that sits superior to the kidney, again in the area that we would suspect adrenal adenoma, most likely proven to be so either by lab values or by another mode of imaging. Next on our list then, we have PHEOCHROMOCYTOMA. PHEOCHROMOCYTOMAs are another benign tumor that arise from the medulla of the adrenal gland. Now this tumor is typically going to be hyperfunctioning, which means that it releases medullary hormones, which include epinephrine and norepinephrine. When a patient has PHEOCHROMOCYTOMA and it is hyperfunctioning, they're going to have kind of all those fight or flight feelings that you have. They're going to have a lot of those feelings all of the time because there's so much extra epinephrine and norepinephrine running through their body. So they're going to have uncontrollable hypertension. They're going to have headaches, fast heart rate. They're going to be kind of shaky, have tremors. They might have some anxiety and excessive sweating that goes along with it. On ultrasound then, again, we will see a solid mass. These are typically on the larger side in the area of the adrenal gland. Their appearance can take on a couple different views. It either can be hypoechoic or it can be heterogeneous. So here we have an example of a PHEOCHROMOCYTOMA. Again, a lot of these are going to be diagnosed either by another mode of imaging or by looking at the patient's clinical signs and symptoms. So here we have a rather large mass in the area that we would expect the adrenal gland to reside. And here's another example of a heterogeneous PHEOCHROMOCYTOMA with some cystic spaces in it. Next up, we have adrenal cysts. Just like cysts anywhere else in the body, the adrenal glands can also develop cysts. So these are simple cysts that arise from the adrenal gland. They can be rather difficult to differentiate if they're in the kidney, or are they in the spleen, or are they in the liver. So again, if it kind of sits in the area that we would expect the adrenal gland to be, we might think, yes, that is a adrenal cyst, but again, hard to definitively diagnose. Ultrasound appearance then, it is going to look like a classic cyst. Smooth walls, anechoic, and through transmission. Here in this example, we can see just that, residing in the area near the spleen, it looks like. So we have the left kidney, spleen, and a cystic structure in that adrenal gland zone. Next to it then we have the CT. We can see the spine here. We see the little bit of the kidney here. Looks like maybe a little bit of the spleen here. We know on the left side that that adrenal gland sits a little bit more medial to the left kidney. So here is that cyst on CT. Next up then we have adrenal carcinoma. Now adrenal carcinoma is cancer of the adrenal gland, and the type of cancer that affects the adrenal glands mostly is the adenocarcinoma. So remember, adenomas can develop on many of our organ systems. They really are just slightly atypical cells from that organ that kind of glob together in a weird way. Adenocarcinomas can develop anywhere that you can get an adenoma. So adenocarcinoma is kind of this probably a weird ball of adrenal tissue that started out and then it mutated into a carcinoma. And even though adenocarcinoma is the most common malignancy of the adrenal gland, cancers of the adrenal gland are still very rare. Now, because the tumor is capable of producing hormones, adenocarcinoma symptoms closely align with those of Cushing's syndrome. On ultrasound then, we will see a solid hypoechoic mass, or we can see again a large heterogeneous mass. Here is an example of an adenocarcinoma. Again, we have a very large mass in the area of the adrenal gland. This one most likely is a tumor. We can see tumor extension into the IVC right here. So whenever you have a large mass, you want to evaluate to see if there's any extension into other organs or possibly into the vascular system. Lastly, then we have adrenal metastases. Adrenal glands are the fourth most common site for metastases. Commonly, we will see metastases come from primary cancers of the lung, breast, or lymphoma. And that brings us to the end of our adrenal pathology. Remember that the adrenal glands are not well seen by ultrasound on adults, so quite often we are just going to catch something that might be an incidental, might be kind of an abnormal thing in the area that we expect the adrenal glands to be. And we need to marry that with the symptoms that they are having to lead to the best differential diagnosis, but ultrasound will not be able to definitively diagnose anything without biopsy or further imaging.